Hello, this is Dr. Vidya T S. I'm a dermatologist and I'm a consultant at Sagar Hospitals. Today I'm going to talk to you about atopic dermatitis, which is the most common skin condition in, I can say, in our country or in Bangalore. So atopy is a group of disease where there is an increased immune response to the allergic reactions. So when you see a patient with skin conditions related to atopy, we call it as atopic dermatitis. Invariably in these patients, when you ask them for the family history, there's either the parents or the grandparents or the siblings, somebody who has either asthma, wheezing, allergic rhinitis, etc., which we call it as a group of atopic diseases. So here they are prone to allergies. So when the child comes to you, either if they don't have any asthma, wheezing in the lungs, they might have dry skin, itching, allergy, itching which leads to scratching, and the scratching leads to eczemas and then the infections and all that. So it's very common to have it in the body folds, behind the knees, elbows, underarms, etc. So this usually starts off in children at a very young age. If it goes on till about 6-7 years, it might disappear, we say. If it stays, it goes on to adolescence or sometimes maybe even longer. So in a place like Bangalore, because of the plants around, the pollen everywhere, pollution, dry weather, this worsens. So when these kind of patients are living in coastal areas, the atopic dermatitis is not so severe like in Bangalore. So the general advice to all these people is, it is a family affair. So everyone has to know what is atopic dermatitis and support the child. So these children are usually irritable because of the severe dry skin and itching. When there is severe dryness, all you have to do is moisturize your skin. So that is where they lack the knowledge. What I tell my patients generally is, not a very hot water bath, because your skin can dry up if you are using extreme temperatures, maybe very hot water or very cold water. No harsh detergents like Dettol or something which can dry your skin more. Not a very long bath, because even that can dry your skin. Pat your skin dry, don't wipe it dry, let the moisture, the water stay on the skin. Apply a moisturizer immediately after bath or within 1 minute after your bath, but apply it liberally is what we say. You cannot apply very little and say that the moisturizer is not working. Apply it liberally all over your body. So this happens all 365 days of a year, but sometimes maybe in winter, because for general people also the skin dries, we say apply it at least twice a day. Suppose you are a sports person, you are out in the sun, in the dust or something, or sweating too much, take a shower in the evening, but it is not a must to use a detergent twice a day. Use a soap in the morning, use just plain water in the evening, wash off all the dust, pat your skin dry, apply a moisturizer and go to bed. Avoid self-medication in all these conditions, because it is not a general thing that you have a skin condition, you have an allergy, itching, just apply moisturizer. Because a lot of people think calamine lotion is a treatment for everything that actually dries your skin. So consult your doctor. Other than these things, when I told you about the hot bath, long bath, moisturizers, you should also at home not have any flowering plants, because the pollen can irritate your skin. Avoid carpets at home, because these children or these adolescents have an allergy to the dust mites, the mosquito bites. They are very prone to mosquito bites, and every lesion can leave pigmentation. They are very prone for hyperpigmentation, and that becomes more of a cosmetic problem. Then the quality of life completely changes. So avoid flowering plants, avoid carpets at home, avoid perfumes and deodorants, not just the patient, but the parents also. Suppose it's a child, even the parent should avoid using a perfume or deodorant on the body, so that it doesn't worsen the eczema in the child. Avoid dusting powders, avoid pets at home. Even pets, the dander, the hair can worsen the atopic dermatitis in children. Also avoid artificially colored food. Avoid woolen clothes, because it can irritate your skin. As much as possible, use cotton, use a sunscreen. Don't apply too much of oil and massage your skin. This is the general rule. If you follow all this, 80% of your eczema is under control. If it worsens, please visit a doctor, and please don't be under the impression that all doctors give steroids. It is not like that. There are some indications where we have to give a steroid, and then it comes under control and it can be maintained with moisturizers. If you follow these general rules, 80% of your atopic dermatitis or atopic eczema is under control. If it doesn't control, you have to visit the doctor. The treatment for pigmentation is different. Once this is all under control, the pigmentation can be taken care.